Hi, I'm Kate Tonta, and this is my poster presenting findings from a recent study modelling pathways to self-injury, looking at the roles of perfectionism, negative affect, rumination, and attentional control. So non-suicidal self-injury, or NSSI, is the deliberate damage to one's body tissue without intending to die and in ways that isn't culturally or socially acceptable. So although you might first think of this as something like cutting, it can also look like burning, scratching, or hitting the self, just as a few examples. My particular area of interest in this study was trying to develop an understanding of how perfectionism might be associated with NSSI. So to look at this, we integrated perfectionism and attention variables with an existing model of NSSI called the emotional cascade model. Specifically, we looked to see if perfectionism was related to increased engagement in self-injury through greater rumination and increased negative affect. We also looked to see how control over one's attention could play a role in affecting these relationships. We used a cross-sectional survey of young adults who reported on their history of self-injury, as well as rumination, perfectionism, negative affect, and attentional control. And we used this data to assess a path model using M+. So the path model and our results looked a bit like this. Perfectionism was directly associated with increased odds of NSSI and also acted indirectly through rumination and negative affect to increase odds of NSSI. The relationship between perfectionism and rumination was moderated by attentional focusing. So although better attentional focusing was directly associated with less odds of NSSI, for individuals who were elevated in perfectionism, the relationship between perfectionism and rumination was stronger for those who had a good capacity to focus their attention. What this means is that although being generally better at focusing your attention is associated with less odds of NSSI, if you are good at attention focusing and high on perfectionism, you may be more likely to experience more rumination or ruminate to a higher degree. Overall, this study indicated to us that an adaptation of the emotional cascade model may be a good way of understanding how perfectionism can increase someone's risk of engaging in NSSI, and also provided some insight into how attentional processes could be involved. Importantly, this study was the first one to kind of test this idea, and because it was cross-sectional, we can't assume that the relationships occur causally in the way that the model suggests. However, bearing in mind that this research does not have causal inference, if we were to think about the clinical implications for these findings, there's a few important ideas. Specifically, interventions which aim to reduce perfectionism may have a flow-on effect for reducing self-injury. This could look like CBT for perfectionism, for example, which uses techniques like cognitive restructuring, behavioural experiments, exposure, and behavioural activation to reduce perfectionism. And the plus side is that many of these techniques are transdiagnostic and would yield benefits in improving rumination and negative affect too. Other avenues for intervention could include metacognitive therapy for worry or rumination, and mindfulness to improve attentional focus. This isn't an exhaustive list of reference, but you might find the following papers of interest. And thank you for your time, and let me know if you have any questions.